September is Ovarian Cancer Awareness Month. While there are treatment options, patients are not often diagnosed until it has spread. Dr. Ebony Hoskins is a gynecologic oncologist at MedStar Washington Hospital Center and is here to share what women should know about this. Good morning to you, doctor. Thanks so much for joining us.
Thank you for the invitation. Glad to be here.
Let's talk about the disease itself and the numbers. I mean, this, I think, impacts more people than folks would think.
Yeah, so ovarian cancer is not as common as it's a common cancer in the gynecologic world, but we don't have screening. So in terms of the amount of people who will be diagnosed in 2023 is nearly 19,000. And the amount of women who can die of the disease is estimated to be over 13,000. And that's in 2023 alone. Our impact in terms of decreasing deaths is a little bit stagnant.
And talk to me about that. We mentioned there that oftentimes when women get the diagnosis, they're in the later stages. And as with any
Correct.
cancer, that makes a big difference in terms of the prognosis. Why is that the case?
I think the biggest case is that we don't have a screening test. So what's different, say, with cervical screening is we have a pap test. And with ovarian cancers, we don't have a screening test that can detect early disease or any type of pre-invasive disease. So we really ask our patients in the community to be in tune with their bodies and any symptoms that may be there. And also really if there's any family history.
Right. Let's get into the symptoms first, because oftentimes I would imagine in hindsight, women think who've been diagnosed, oh my goodness, yeah, I was feeling that, but I thought it was something else or something I didn't have to be worried about. So talk to me about the symptoms.
Yeah, so it is considered a silent disease, if you will, but the symptoms are subtle. Abdominal distension, meaning bloating. Some patients may feel like they can't eat as much as possible, like not eating as much, but also that their belly is distended. Some have pelvic pain or abdominal pain, any change in urination or, having bowel movements. And they're really nonspecific. We recognize that there are other diseases that can have that, or even just indigestion. So when symptoms are persistent and progressive or getting worse, really I'd say over 2 weeks, we advise that you would see a gynecologist. If your first stop is your primary care doctor, that's a good place to start.
Yeah, so it's really a matter of being proactive and advocating for yourself. For folks, you mentioned the having a family member perhaps who's gotten ovarian cancer. What's the connection there?
So there are genetic mutations, and as we're learning more about genetics, one familiar mutations that you may have heard of is BRCA1 and 2. Those are the most common genetic mutations that are associated with ovarian cancer or fallopian tube cancers. There are also other mutations, but I think those are not as recognized. Yeah. So if a family member, first-degree relative, mom, sister, that may have had a history, even breast cancer, or if there's a lot of breast cancer, ovarian cancer in the family, that may be a time where the family or someone who's affected to get tested. So
it's really a matter of what you said, asking those questions, being informed, but especially being in tune with your body, because a lot of times your body will tell you something's off. Dr. Ebony Hoskins joining us this morning from MedStar Washington Hospital. There's the information, by the way, if you'd like some additional resources and more information. Dr. Hoskins, thanks again.
Thank you.